So in this round, we're going to have Marshall B. Ketchum and UC Davis. So welcome aboard. And when we get the questions ready here, we'll start going. Okay, we're ready. Question number 1. A 40-year-old woman with a past medical history of hepatitis C presents with an itchy rash on her arms and wrists. On physical exam, there are fine white lines in a lace-like pattern on the surface of the papules. What is the suspected diagnosis? Okay, Marcia B. Ketchum, you rang in, so go ahead and give your answer.
Lichen planus.
And that is correct answer. Question number 2. What are the most common causes of atrial fibrillation in resource-rich countries? Marcia B. Ketchum?
Hypothyroidism.
That is an incorrect answer. UC Davis, you want to try?
Hypertension.
Hypertension? That's a correct answer.
So Marshall B. Ketchum has 100, or is it minus? So UC Davis has 100. And then Marshall B. Ketchum is 0.
Question number 3. Pancreatic tumor is associated with which multiple endocrine neoplasia? Marcia B. Ketchum?
MEN1.
That is a correct answer. Question number 4. An 18-year-old woman presents to the emergency department with a sore throat and a muffled voice. She states her symptoms started 3 days ago and have significantly worsened since the onset. Vital signs are remarkable for temperature, 38 degrees centigrade, a heart rate 100 beats per minute, respirations 18 per minute, blood pressure of 120/60, and an SpO2 of 99%. On exam, the patient has a muffled voice without evidence of drooling. She has some difficulty opening her mouth for you, but when she finally does, you note fullness of the right tonsillar pilar with uvular deviation to the left. A lateral neck x-ray is performed and is shown above. What is the most likely diagnosis? UC Davis.
Peritonsillar abscess.
That is a correct answer. Question number 5. The triple screening test done in the second trimester of pregnancy is screening for what disorder? Time is up. The correct answer is trisomy 21 or Down syndrome. Question number 6. Which artery does the uterine artery branch from? Marcia B. Ketchum?
Internal iliac artery.
internal iliac artery?
Yes.
That is correct.
Nice.
Question number 7. The Lockman test examines the stability of what area of the knee? UC Davis.
ACL, anterior cruciate ligament.
That's correct. Question number 8. What type of Salter-Harris fracture is characterized by a fracture through the physis and epiphysis? Marcia B. Ketchum.
Salter-Harris type 3.
That is correct. Question 9. What type of vitamin deficiency is characterized by pharyngitis, cheilitis, glossitis, seborrheic dermatitis, and normocytic normochromic anemia? Marcia B. Ketchum.
Vitamin B3, niacin.
That is an incorrect answer. Davis, do you want to try? No, looks like Davis does not want to try. The correct answer is riboflavin vitamin B2. The last question of the round.
Did we deduct points?
Yes.
Last question of the round, question 10. What is the most common site of metastases for colorectal cancer? Marcia B. Ketchum.
Liver.
The liver is correct.
Nice.
So we have a tie, so we need to go to a tiebreaker. Tiebreaker question 1. What color is seen on gram stain with Candida species? UC Davis.
It's the like pink orange color.
That's incorrect. Okay, time is up. The answer should be purple. Let's do another tiebreaker. Oh, we're done. So the winner of that round is Marshall B. Ketchum. You're moving on. Thank you so much. Thank you, UC Davis. Appreciate it.
Great job, UC Davis. Good luck on your rotation. Good luck.
You too. Thank you. Great job, guys.
So now we're going to take a short break and get ready for the other teams. So give us a few minutes, please. Thank you. Hello and welcome back to the second round of the California PA Student Challenge Bowl. Second round, we have Cal State University, Monterey Bay, and Cal Baptist. Question number 1. What type of tremors occurs with the voluntary movement of muscle? Cal Baptist.
Essential tremor.
Could you say that again?
Essential tremor.
I had to turn my volume up a little bit. Could you say that again one more time loud?
Essential tremor.
Can you give me more of a general category?
Oh, intention.
Intention tremor.
That is not the answer we're looking for. Monterey Bay want to chime in? Very good. The correct answer is action tremor. Question number 2. This is a long one. Question 2. A 62-year-old man presents to the hospital reporting generalized weakness and multiple episodes of vomiting blood. The vomiting started yesterday and has persisted since onset. The patient takes no medications. He does not have housing and has no medical problems, but has not had routine medical care in 30 years. He reports no illicit substance use, but has consumed alcohol daily for 40 years. Vital signs are notable for a temperature of 100.9 degrees Fahrenheit, heart rate of 120 beats per minute, respiration rate of 22 breaths per minute, blood pressure is 75/38, a pulse oximetry of 94% on room air. On exam, you find an ill-appearing, lethargic older man who is pale, diaphoretic, and vomiting coffee ground emesis. The rectal exam is notable for black tarry stool. What is the best next step in management? Monterey Bay.
Fluid resuscitation.
Fluid resuscitation. That's not the answer we're looking for. Cal Baptist, you want to try? Okay, we'll go on. The correct answer was transfuse blood products. Question number 3. A 22-year-old man with HIV who has discontinued his medication regimen presents with a CD4 count of 150 cells per microliter, dyspnea on exertion, and non-productive cough. Which medication is the most appropriate to treat the suspected diagnosis? Cal Baptist.
Bactrim.
Bactrim is the correct answer. Question number 4. Which structure is cut in a vasectomy? Monterey Bay.
The vas deferens.
The vas deferens is correct. Question 5. What is an expected dermatological finding of Lofgren's syndrome? Nobody? Yeah, sorry, I didn't know this one either. And the answer is erythema nodosum. Question number 6. Which disorders are included in the cluster B personality disorders? Monterey Bay.
Narcissistic.
Schizoid,
Schizoid.
schizotypal,
Schizotypal.
and borderline.
And borderline.
We are considering the answer. Yeah, we were looking for 2. You got the 2, so you get credit for that answer. And the correct answer was narcissistic, histrionic, borderline, and antisocial. Questions? Go and show the score. Question number 7. What is the hallmark of electrolyte abnormality that is the predominant cause of refeeding syndrome? Cal Baptist.
Hypomagnesemia.
That is not a correct answer. Monterey Bay, you want to answer or no? No? Okay. The correct answer is hypophosphatemia. Question 8. A 26-year-old man presents to the emergency department with eye pain. Fluorescein staining and the wood lamp examination shows the above finding. What is the most appropriate next step in management? Time is up. The correct answer is erythromycin ointment. Question number 9. What is an absolute contraindication to carotid artery stenting? Cal Baptist?
What is complete occlusion?
Sorry, could you say that louder, please?
Complete occlusion?
Oh, complete occlusion. That is a correct answer. Question number 10. Which maneuver is commonly used in the treatment of benign paroxysmal positional vertigo? Cal Baptist?
Epley.
That is the correct answer. So it looks like we have a tiebreaker, so we will give you a question. An 18-year-old man presents from a baseball game where he was pitching. He heard a sudden pop, and on physical exam, he has a pop eye deformity. What is the most likely diagnosis? Cal Baptist?
Biceps tendon rupture.
That is correct. That's it. Yeah. We're going to be moving to the next round. Cal Baptist wins this round. Thank you so much. Good job. Appreciate everything you've done. Monterey Bay, thank you so much. Now we have USC and Chapman. So let's get to the first question. This is a long one. Question 1. A 50-year-old man presents to the clinic for his annual exam. He has a history of hypertension that is controlled on lisinopril, 20 milligrams daily. Review of symptoms includes some mild fatigue, blurry vision, and tingling in the lower extremities. Vital signs include blood pressure of 122/82, heart rate of 78 beats per minute, respiration of 16 per minute, temperature 98.7, and a BMI of 31.0. Physical exam is unremarkable. What immediate test result would be consistent with a diagnosis of type 2 diabetes if found in this patient? USC.
Point of care, hemoglobin A1C.
That's not the answer we're looking for. Chapman?
Random blood sugar over 200.
That is a correct answer. Show the scoreboard. Question 2. What type of breech presentation is characterized by both of the fetus's hips being flexed and both knees being extended? Chapman?
Frank breech.
That is a correct answer.
Her scoreboard's not working for some reason, so let's move on to
The scoreboard is not working. We will update it as soon as we can get it going again, but we will continue.
Right now, Chapman at 200, USC at minus.
So right now USC is at 200.
Minus
Uh,
100.
Excuse me, my bad. Chapman's at 200 and USC is at minus 100. Question 3. The left testicular vein drains into which vein? Chapman,
Left, the left renal vein.
that is correct. Chapman's at 300, USC is at minus 100. Go to question 4. At what age does the moral or startle reflex appear? Chapman,
It appears at birth.
that is not the answer we have. USC want to take a shot at it or no? Nope, they don't want to. Okay.
Answer.
The correct answer is 28 to 36 weeks or 7 to 9 months. Chapman is at 200, USC is at minus 100. Question 5. Which drug has the highest risk of causing drug-induced lupus? Time is up. The correct answer is hydralazine or procainamide. Let's go to question number 6. A patient has an infection that destroys the integrity of their mitral valve. What would be expected functionality as a result? USC.
Mitral regurgitation.
That is a correct answer. So Chapman 200, USC 0. Question number 7. What is the first line treatment for akathisia? Chapman,
Antihistamines.
that is an incorrect answer. Okay, time is up. The correct answer is a beta blocker, usually propanolol. Score Chapman 100, USC 0. Question number 8. What type of surgery is required to manage pheochromocytoma? Chapman,
Adrenalectomy.
that is a correct answer. Chapman 200, USC 0. Question number 9. What is the most common cause of pancreatitis? Chapman,
Gallstones.
the answer is gallstones. USC buzzed in early, so they get minus 100 points on that. Chapman gets 100 points on that. So Chapman 300, USC minus 100. And we are on the last question, number 10. A 23-year-old woman presents to a local urgent care for the evaluation of a headache. She has been experiencing a headache for the past week while studying for her final exams. She describes her headache as if her head was being squeezed in a vise. Her headache is not exacerbated by physical activity. She has not experienced nausea or vomiting. Vital signs are within normal limits. Physical exam is normal other than mild soreness to the palpation of her upper cervical spine and her scalp. What is the most likely diagnosis? USC.
Tension headache.
That is correct. Right now, we will have Southern California University of Health Sciences and the University of the Pacific. First question. Question number 1. What is the most likely diagnosis of a patient who presents with eye pain, muscle weakness, and numbness in the lower extremities, lumbar puncture with oligoclonal bands, and an MRI finding of periventricular plaques? University of the Pacific?
MS.
That is a correct answer. UOP 100, Southern California University, 0. Question number 2. You are called to assess a 56-year-old man with no previous medical problems after a computed tomography guided needle biopsy of a left lung lesion. His blood pressure is 88/50. He appears to be short of breath and anxious. His breath sounds are unequal with no breath sounds on the left. What is the best next step in the management of this patient? University of Pacific?
Needle decompression.
That is a correct answer.
Nice.
University of the Pacific 200, Southern California University 0. Let's move on to the next question. Question 3. What is the shape of the crystals associated with pseudogout? Southern California University?
Needle.
That is incorrect. University of the Pacific?
Rhomboid.
Rhomboid is a correct answer. We have UOP at 300 and Southern California University of Health Sciences at -100. Let's go to question number 4. What is, we're on the wrong question. There we are. What is the most likely diagnosis in a patient with recurrent pneumonia, daily cough productive of thick, yellow, foul-smelling sputum, and CT findings of a tram track pattern? Southern California University?
Strep pneumo. Strep
That is an incorrect answer. Okay, time is up. The answer we're looking for is bronchiectasis. So that makes UOP at 300 and Southern California University at -200. Let's go to the next question, number 5. Prior to what age must symptoms occur to make the diagnosis of attention deficit hyperactivity disorder? Okay, time is up. The answer we were looking for is 12 years of age. UOP 300, Southern California University, minus 200. Let's move to question number 6. The difference between the amount of oxygen in the alveoli and the amount of arterial oxygen is called? The time is up. The answer we are looking for is an AA oxygen gradient. UOP 300, Southern California University, minus 200. Question number 7. What type of vaccination is contraindicated in patients with a history of hypersensitivity to yeast? The answer is up. The answer we're looking for is hepatitis B. UOP 300, Southern California University of Health Sciences, minus 200. Question number 8. There we go. What is the length of time it takes for the uterus to return to its non-pregnant size postpartum? Time is up. The answer we're looking for was 6 to 8 weeks. UOP 300, Southern California University of Health Sciences, minus 200. Let's go to question number 9. What is the primary cause of chalazion? Time is up. We're looking for obstruction of the Zeiss or the meibomian gland. The last question, UOP, question 10. Which stage is a pressure ulcer when it involves the full thickness of the skin and may also extend into the subcutaneous layer? Southern California University.
Stage 3?
That is correct. So Southern California University, minus 100, UOP 300. Congratulations to UOP. You're moving on to the next round. Welcome back to the PA Challenge Bowl. This round we have Western University versus Loma Linda. Welcome both. A 72-year-old man presents to the emergency department with sudden onset of left-sided chest pain, diaphoresis, and a shortness of breath. The patient has a history of hypertension, hyperlipidemia, and diabetes. In the ED, his vital signs are blood pressure is 136/92, heart rate 102, respirations 18, O2 sat of 97% on room air. Aspirin is given to the patient, and his ECG can be seen to the right. What location is the patient's myocardial infarction? Western?
Inferior?
Inferior is a correct answer. Western 100, Loma Linda 0. Go to question number 2. A 3-year-old child presents to the clinic for hearing loss. What structure located in the middle ear could cause this hearing loss? Loma Linda?
The tympanic membrane?
That is an incorrect answer. Time is up. The correct answer we're looking for is the malleus. Western is 100. Loma Linda has minus 100. Question number 3. An 8-year-old boy presents via EMS from his school cafeteria due to shortness of breath, retractable vomiting, and hives over his extremities while eating lunch. What type of allergy has he developed? Loma Linda,
IgE, anaphylactic reaction.
that's not the answer we're looking for. Time is up. So the answer that we have is type 1 hypersensitivity reaction. Western 100, Loma Linda minus 200. Question number 4. What disease is most commonly associated with dermatitis herpetiformis? Loma Linda,
Celiac disease.
that is a correct answer. Loma Linda minus 100, Western U 100. Question 5. Which triad is composed of aspirin or NSAID hypersensitivity, asthma, and nasal polyps? Loma Linda,
Stepto's triad.
that is not a correct answer.
Was it the
Western,
the atopic triad?
that is not a correct answer. So Western 0, Loma Linda minus 200. The correct answer was Sampter triad.
That's what we said.
That's not what I heard. I'm sorry. Did you hear that? Loma Linda said they said that. It's not what I heard. Give us 1 minute to sort this out, okay? Okay, so we have corrected your answer, Loma Linda. We will credit you with that score. And so based upon what you had prior to that, now you have 0 as a total score. And because you answered that question correctly, Western University wouldn't have been able to answer that. So we will restore Western's score to what it was originally. So with that, we have Western at 100 and Loma Linda at 0. Okay, thank you. Question number 6. I can turn up my volume too. Okay, so we will go to question number 6. I just ask that everyone speak up a little bit. I'll turn up my volume on my computer as well, so that won't happen again. Okay, thank you. Sorry. Okay, question 6. A 26-year-old woman with a past medical history of severe mitral stenosis presents at 8 weeks gestation. What arrhythmia is she at highest risk for? Time is up. The answer we are looking for is atrial fibrillation. So the score is still the same, Loma Linda 0, Western 100. We will go to question number 7. What is the most common type of uterine cancer? Western? Western?
Go. Adenoma. Adenoma.
That is not a correct answer. Okay, time is up. The answer we're looking for is endometrioid carcinoma. Score at this point, Western is 0, Loma Linda is 0. We're at question number 8. What is the name of the disorder which the retracted foreskin in an uncircumcised man cannot be retracted back over the glans penis? Western?
Paraphimosis?
That is a correct answer. Western 100, Loma Linda 0. Question number 9. A bag of worms on physical exam supports what diagnosis? Loma Linda.
Varicocele.
That is a correct answer. Score is Western 100, Loma Linda 100. Question number 10. An 82-year-old woman presents with decreased mentation, profound weakness, maculopapular rash, and flaccid paralysis. Lumbar puncture shows a positive MAC-ELISA test in the CSF. What is the most likely etiology of this patient's presentation? Time is up. The answer we're looking for was West Nile virus. So the score is tied. We will need to go to a tiebreaker round. Tiebreaker question. What prostate zone is the largest area of the prostate and is the most common site for prostatic adenocarcinoma? Time is up. The answer we're looking for is the peripheral zone. Okay, so score is 100 Western, 100 Loma Linda. Tiebreaker question 6. What genetic mutation is responsible for Polycythemia vera? Time is up. And the answer is the JAK2 gene. Next tiebreaker. What is the most likely diagnosis in a patient who presents with white plaques on the inside of his cheek that are painless and cannot be scraped off? Loma Linda?
Leukoplakia.
That is a correct answer. Thank both teams. Loma Linda, you're moving on to the next round. We have Charles Drew versus Touro. Okay, so we will start with question 1. Where is the lesion or defect located in a patient with left homonymous hemianopia? Time is up. The answer we were looking for is the right optic tract. So Touro 0, Charles Drew 0. Question number 2. Thank you for your patience. This is the correct question number 2. A 28-year-old woman comes in for her first checkup following a positive pregnancy test. On exam, there is a bluish discoloration of the cervix and the vulva. What is this referred to as? Charles Drew?
Chadwick sign.
That is a correct answer. So the score stands right now, Charles Drew 100, Touro 0. We will go to the next question. Question 3. What occurs classically in an ovulatory woman who develops secondary amenorrhea or hypomenorrhea after an intrauterine procedure, particularly if the procedure was performed on a gravid uterus? CDU?
Asherman syndrome.
That is a correct answer. Charles Drew, 200, Touro, 0. Let's go to question number 4. With the patient lying on their back, they have pain when you flex the knee and hip to 90 degrees and internally rotate the hip. What is this physical exam finding called? Touro?
Positive obturator sign.
That is a correct answer. So Touro, 100, Charles Drew, 200. Question number 5. Obturator sign was correct. Question number 5. What type of bacterium is Pseudomonas aeruginosa? Touro?
Anaerobic.
It's not the answer we're looking for.
Gram negative.
It's,
I don't think you can do that.
don't say anything.
Charles.
Charles Drew, do you want to chime in? Okay. The answer we're looking for is a gram-negative bacillus. We had to go with your first answer, Touro. Score Touro 0, CDU 200. Let's move to question number 6. What is the name of the test that elicits pain localized to the long biceps tendon when attempting to supinate and flex the arm against resistance? Time is up. The answer we're looking for is a Jurgensen. Score Touro 0, CDU 200. Let's go to question 7. What type of electrolyte abnormality is most likely to be seen in a patient with hypoaldosteronism and renal tubular acidosis? Touro?
Hyponatremia.
That is not a correct answer. CDU, do you want to try? Okay, time is up. The answer we were looking for is hyperkalemia. Score, Charles Drew, 200, Touro, -100. Let's go to question number 8. What disorder is associated with an intellectual deficit, epilepsy, and a musty urine smell? Time is up. The answer we're looking for is PKU or phenylketonuria. Score, Touro -100, Charles Drew 200. Let's move to question number 9. What is the name of the process that results in unexplained superficial migratory thrombophlebitis and is associated with carcinoma of the pancreas? Time is up. The answer we're looking for is Trousseau syndrome. Touro -100, CDU 200. And we will go on to question 10, the final question. What is the most common type of cyanotic congenital heart defect? Charles Drew?
Tetralogy of Fallot.
That is a correct answer. So final score, Charles Drew 300, Touro -100. Welcome back to the semifinals. On the first heat, we have Marcia B. Ketchum and Cal Baptist. Again, question 1. What type of cardiomyopathy is associated with echocardiogram findings of normal size and dimension of the ventricles, diastolic dysfunction, and dilation of both atria? Time is up. The answer we were looking for is restrictive cardiomyopathy. Let's go to the question number 2. A 68-year-old woman presents to the emergency department with anxiety and palpitations that started this afternoon. She states that she has a past medical history of anxiety managed with clonazepam, but has not taken her medications in a few days. During the interview, the patient's responses became more incoherent, and she ceases to answer questions appropriately. Her temperature is 99.5 degrees Fahrenheit or 37.5 degrees Celsius. Blood pressure is 77/38. Respirations are 27 per minute, and O2 sat is 98% on room air. A cardiac strip is seen above. What is the most appropriate next step in management? Marcia B. Ketchum?
Synchronized cardioversion.
That is a correct answer. So Marcia B. Ketchum 100, CBU 0. Let's move to question number 3. Which skin cancer is commonly preceded by actinic keratoses? CBU?
Squamous cell carcinoma.
That is a correct answer. Score, Cal Baptist 100, Marcia B. Ketchum 100. Let's move to question number 4. What is the most common site of obstruction for kidney stones? Marcia B. Ketchum?
Intramural.
That is not the answer we are looking for. Okay. The answer we're looking for is the ureterovesicular junction. MBKU 0, CBU 100. Let's move to question number 5. What type of nutritional deficiency is seen in Plummer-Vinson syndrome? Time is up. The answer we're looking for is iron deficiency anemia. Score, CBU 100, Marcia B. Ketchum 0. Let's move to question number 6. Our rods within a blast cell are pathognomonic of what disease? CBU?
AML.
That is a correct answer. So CBU is 200, Marcia B. Ketchum 0. Let's move to question 7. What cells produce and secrete pleural fluid into the pleural cavity? Time is up. The answer we are looking for is mesothelial. Let's move to question number 8. MBKU is 0, CBU is 200. Question 8. What is the first line pharmacotherapy for treating a patient with bulimia nervosa? CBU?
Fluoxetine.
That is a correct answer. CBU 300, MBKU 0. Let's move to question number 9. What cranial nerve is responsible for tongue movement? MBKU,
Hypoglossal cranial nerve 12.
perfect on both, correct, thank you. Correct answer. MBKU 100, CBU 300, question number 10. A 50-year-old man with a 30-pack year smoking history presents with difficulty breathing and a non-productive cough that has progressively worsened over the last 6 months. Pulmonary function testing reveals a decreased total lung capacity and residual volume. However, there is a normal forced expiratory volume in 1 second to the forced vital capacity ratio. What is the most likely diagnosis? Marcia B. Ketchum.
Lung cancer.
That is an incorrect answer.
Wow.
The CBU, did you want to try or no?
Emphysema.
That's an incorrect answer as well. So the final score in this round, CBU 200, Marshall B. Ketchum 0. We will let everyone know who's going to be moving into the next round.
Great job,
Thank you.
Good luck.
Take care. Thank you.
Welcome to the next round of the Student Challenge Bowl. This round we have Chapman and we have UOP. Question 1. Compression of a cardiac chamber due to increased pericardial pressure is indicative of what disorder? UOP?
Cardiac tamponade.
That is a correct answer. Correct. Pericardial tamponade, cardiac tamponade. Question number 2. What is the most common pathogen responsible for a soft tissue infection following cat scratches, cat or dog bites, or licks? Chapman?
Pasteurella.
That is a correct answer. UOP 100, Chapman 100. Question number 3. A 16-year-old girl presents following a cat bite on her wrist a week ago. There is tenderness along the flexor sheath and pain on the tendon with passive extension. She is diagnosed with flexor synovitis. What is the name of the physical exam finding described above? Chapman?
Positive Finkelstein's test.
That is not the answer. Time is up. The answer we're looking for is canaval signs. Chapman 0, UOP 100. Let's go to question number 4. What is the major cause of nephrotic syndrome in non-diabetic adults? Chapman?
Focal segmental glomerular nephritis.
That is not the answer. That's not the answer we're looking for. UOP, you gonna take a shot at it? No? Okay. So the answer we're looking for is membranous nephropathy. Chapman minus 100, UOP 100. Let's move to question number 5. What type of vitamin deficiency is characterized by hemorrhage, hyperkeratosis, hypochondriasis, and hematologic abnormalities? UOP?
B3.
Could you repeat that?
B3.
Did you say B3?
B3. B.
Yeah, thank you. Thank you. That's incorrect. Chapman?
Vitamin C.
Vitamin C is the correct answer. So Chapman 0, UOP, UOP 0, 0, 0. Let's go to question number 6. What class of medications are used as the first line therapy for postmenopausal women with osteoporosis? Chapman?
Bisphosphonates.
That is a correct answer. Chapman 100, UOP 0. Let's move to question number 7. What is the most common agent responsible for a pediatric patient presenting with stridor and a barking cough? UOP?
Parainfluenza.
That is a correct answer. So Chapman 100, UOP 100. Let's go to question 8. What is the most specific cutaneous eruption associated, let me reread. What is the most specific cutaneous eruption association with dermatomyositis? Time is up. The answer is heliotrope rash. Chapman 100, UOP 100. Let's move to question number 9. What is the most common complication of endoscopic retrograde cholangiopancreatography? Chapman?
Pancreatitis.
That is a correct answer. Chapman 200, UOP 100, question number 10. What is the suspected diagnosis of a patient status post-motor vehicle collision with a head CT scan revealing a convex density? UOP?
Epidural hematoma.
That is a correct answer. So that gives UOP 200 and Chapman 200. That puts us in a tie break. So give us a second to get the tie break question, okay? Here's the tiebreaker question. What is the gold standard diagnostic evaluation for the initial diagnosis and staging of bladder cancer? Chapman?
It's cystoscopy with biopsy.
That is a correct answer. That is correct. Chapman wins the round.
Congrats.
Thank you for participating. Chapman 300, UOP 200.
Thank you, guys.
Thank you, UOP, for welcome to the next round of the semifinals Student Challenge Bowl. We are going to have Charles Drew and Loma Linda. Question 1. A 50-year-old woman presents to the clinic for a new consult. She is able to provide a fragmented medical history, but brought her medications with her. One of her medications is warfarin, and she has been on it for 5 years. Given the patient's age and medication history, name one of the 2 most likely cardiac indications for which this patient is taking this medication. Loma Linda.
Atrial fibrillation.
That is a correct answer. The other answer would have been a mechanical heart valve. Either answer would have been correct. So at this point, Loma Linda 100, CDU 0. Let's move to question number 2. What condition is characterized by loss of muscle mass, strength, and performance and is seen in the aging population? Time is up. The answer we were looking for is sarcopenia. The score is Loma Linda 100, CDU 0. Let's move to question number 3. A patient presents to your emergency room with severe diarrhea after being on clindamycin for a tooth infection. You are highly suspicious of Clostridium difficile colitis. The patient's vital signs are pulse is 125, blood pressure is 122/76, temperature of 38.1, pulse ox of 97%. The patient does not appear to be in severe distress. However, white blood count is 19,000 with 15% bands and having multiple bouts of diarrhea. You plan to admit the patient and give IV fluids. What is the IV antibiotic treatment of choice for this patient? Charles Drew?
IV doxycycline.
That is not a correct answer. Loma Linda?
Vancomycin.
That is not a correct answer. The answer we were looking for is metronidazole. Loma Linda has 0, CDU minus 100. Let's move to question number 4. A 22-year-old woman presents with abdominal pain for 2 days that worsens during intercourse. She also complains of increased vaginal discharge. She has a temperature of 101 degrees Fahrenheit. Pelvic exam reveals cervical motion tenderness and purulent discharge, but no adnexal mass. What is the most appropriate outpatient treatment for the suspected diagnosis? Time is up. We're looking for treatment for a PID, and it would have been ceftriaxone with doxycycline and with metronidazole. So Loma Linda 0, Charles Drew minus 100. Let's go to question number 5. What is the most abundant type of antibody found in colostrum and breast milk? Charles Drew?
IgM.
That is an incorrect answer. Well, Melinda, are you going to give it a try?
No, thank you.
Okay. The answer we were looking for is IgA, specifically secretory. Charles Drew minus 200, Loma Linda 0. Let us move to question number 6. What is the leading cause of adult blindness in industrialized countries? Loma Linda.
Macular degeneration.
That is correct. Loma Linda 100, Charles Drew minus 200. Let's go to question number 7. A 22-year-old swimmer presents with right-sided ear pain. On exam, the external canal is erythematous and edematous, and there's also tragal tenderness. What is the most likely infectious etiology in this patient? Loma Linda.
Pseudomonas aeruginosa.
That is correct. Loma Linda 200, CDU minus 200. Let us move to question number 8. What class of medication should be given first when preparing a patient for corrective pheochromocytoma therapy? Time is up. The answer that we were looking for was alpha adrenergic blocker. So Loma Linda 200, CDU minus 200. Let us move to question number 9. What dermatological finding appears as a soft, pedunculated lesion on narrow stalks? Time is up. The answer we're looking for is acrocordon or just a plain old skin tag. So at this point, Loma Linda 200, Charles Drew minus 200. Let's move to the last question of the round, question 10. What is the maximum score in the CHA2 DS2 VASC scoring system? Time is up, and the answer is 9. All right, so thank you very much. The winner of this round was Loma Linda at 200. CDU had a minus 200. Welcome everyone to the final round of the Student Challenge Bowl. So the winner of this 3 team will be declared the winner of this year's Challenge Bowl. So let's get started on the first question. A 35-year-old woman presents with fatigue, headache, and gingival bleeding. She had always been healthy, but this year she had pneumonia and just got over a urinary tract infection. CBC reveals pancytopenia. Bone marrow core biopsy reveals hypocellularity. What is the most likely diagnosis? Okay, Chapman buzzed in early, minus 100. And time is up. The answer we were looking for is aplastic anemia. So at this point, CBU 0, Chapman minus 100, Loma Linda 0. Let's move to question number 2. A 4-month-old baby who was born prematurely presents to the hospital with difficulty breathing. What is the most common cause of bronchiolitis in this age group? Loma Linda?
RSV.
That is a correct answer. At this point, CBU 0, Chapman minus 100, Loma Linda 100. Let us move to question number 3. In a patient with severe sulfa allergy, which medication can be used as a treatment for pneumocystis pneumonia? CBU?
Pentamidine.
Pentamidine is a correct answer. CBU 100, Chapman minus 100, Loma Linda 100. Let us move to question number 4. What is the primary function of the cornea of the eye? Time is up. The answer we were looking for is refraction or bending of light. CBU is 100, Chapman minus 100, Loma Linda 100. Let's move to question number 5. A 25-year-old woman presents to urgent care reporting that she is afraid she has breast cancer. She has had multiple visits to the emergency room with the same complaint over the past year. Findings of her physical exam, laboratory, and radiographic studies are negative. She reports her best friend at work has been undergoing treatment for breast cancer. What is the most likely diagnosis? CBU?
Hypochondriasis.
We will take that as a correct answer. We were actually looking for illness anxiety disorder, but hypochondriasis is equally effective. CBU 200, Chapman -100, Loma Linda 100. Let us move to question number 6. What 2 vaccinations are recommended for a patient diagnosed with COPD? CBU?
Influenza and pneumococcal.
That is correct. CBU 300, Chapman -100, Loma Linda 100. Let us move on to question number 7. What medications are most commonly used for preoperative surgical antibiotic prophylaxis?
-100 Chapman.
Time is up. Chapman, you buzzed in early. That's a -100. The answers we were looking for could have been any one of these: cefazolin, vancomycin, or gentamicin. At this point, CBU 300, Chapman -200, and Loma Linda 100. Let us move on to question number 8. A 48-year-old man presents with left lower quadrant pain. He reports no nausea or vomiting, but has had chronic constipation. His last bowel movement was 2 days ago. He noted no blood in his stool. He is febrile with a heart rate of 110 and a blood pressure of 150/62. Oxygen saturation is 98% on room air. He has left lower quadrant tenderness with no rebound or guarding, and his bowel sounds are hypoactive. What is the most likely diagnosis? Loma Linda.
Diverticulitis.
That is a correct answer. At this point, CBU is with 300, Chapman -200, Loma Linda 200. Let us move to question number 9. A 4-year-old boy is diagnosed with viral rhinitis. What is the most common cause of viral rhinitis? CBU?
Rhinovirus.
That is a correct answer. CBU 400, Chapman -200, Loma Linda 200. Question number 10. Which organ is indicated by the arrow above? Loma Linda.
The spleen.
The spleen is the correct answer. So the final score, CBU 400, Chapman -200, Loma Linda 300. Congratulations, CBU. You are this year's winner of the Student Challenge Bowl.